Hey guys, come in for a little bit of a check-in. I was supposed to go to my friends today for the diamond painting group. Um, I can't make it. I already told them, but I can't make it. The humidity is too much for me today. Me just going downstairs to go to the bathroom sent me into an instant asthma attack. Instant asthma attack. So, yeah. I know I'm not going to be able to go outside just to take puppers or for any other reason that is not of life-threatening, category. That, and I'm overly tired for some reason. I don't know why I've been sleeping, but I'm tired. So, yeah. I have been working on the one that I'm supposed to do at my friend's. So, yeah. Here's hubby. He needs to go down and go potty. So, yeah. So I'm going to be homebound today, stuck in my quarantine room. Excuse me. Yeah. I was looking forward to getting out of the house for a little bit today, but I can't. My body won't let me. So yeah, so I'm probably just going to be staying up here and working on the diamond painting and probably take a nap again. I took one earlier because I've been up since around 4 o'clock in the morning. And I sat down and I did a couple things sorting while I was just sitting here. And I fell asleep until about 9, around 5. So it's about 4 hours. And then I woke up, called my insurance to see if they had switched over to a different provider for me, primary care doctor. They said they hadn't, so I called my primary to schedule the appointment that I had to cancel at the beginning of the month. And to find out my doctor is switching fields. She's going from being a doctor of, primary doctor to being a behavioral doctor. So, yeah. And so that sucks. That means I have to see the newer provider there who's taking on all of her patients. And last time something like this happened to me, there was a lot of medical trauma with me. I was gaslit for so long. And yeah, then I started seeing one of the older providers there who had since retired. But she took very good care of me, Anything I needed, she tried to do her best to get me at no cost. And yeah. And then when she retired, my now doctor, who's now switching fields, was very much similar to her in that perspective of, listening to your patients and getting them the help that they need. So, yeah, I'm hoping that this doctor is like that, in that category, because if not, Yeah. And what sucks is I noticed that most of the doctors that I have found who listen to their patients and help their patients, the majority of them are women. Right now, the only male doctor that is listening to me is my rheumatologist. So, other than that, it's been women. Because even with an endocrinologist, he wasn't listening to me. He, oh, you're fine. All your lab work came back fine. You're fine. You're fine. You're too young. It's all in your head. You're making it up. It's anxiety. You're overweight. I quit seeing him. Same thing with my OB, who was a woman. She was the one who diagnosed me with PCOS. After 2 years of pretty much every other day being in the emergency room and being labeled as a drug addict at the time. It took her to the point of 2 years of that to finally do an exploratory surgery to find out that my right ovary had twisted itself around with the fallopian tube and was starting to decay with a softball-sized cyst in my ovary. Yeah, that label of drug addict quickly came off of my medical record, and yeah, but I still don't see an OB. She moved to a different state, and yeah, even the person, the hand surgeon who did my trigger finger surgery, he listened. Like, the way he did treatments was more so on the brutal side of things. Like, let's say you went in for your arthritis in hands, carpal tunnel. There would be no physical therapy, no let's try this medication. It's straight to, oh, we're giving you surgery, and that's that. You're not getting any pain medication, or if you do, you're getting very little of it. This doctor is now being sued the state of Michigan and is a flight risk. He is in a different state trying to have his practice there. So, yeah. My pulmonary function doctor, he is hit and miss when it comes to listening to patients. Like, it took him 3 years with me to realize that what I'm saying is what I'm dealing with on a daily basis. He was so much like that. Oh, you're too young, you're overweight, you're a smoker, you're anything and everything else besides what I was saying. And it took his partner seeing me for 2 times to go to him to say, you know what, she's in worse condition than what you think. You need to get her all these tests done. And that stress test of breathing, to test your lung capabilities. Yeah, I fell so short of where I was supposed to be. So yeah, now he listens if it is severe enough. But if it's just like, yeah, I've had a couple of asthma attacks since our last visit, the humidity has really been messing with me. He's like, okay, well, just keep doing what you're doing. Yeah. Alright guys, I am going to end the video here. I want to take a nap. So. I'll see you guys a little later.